My topic today is about methicillin-resistant Staphylococcus aureus, commonly called MRSA. MRSA is an infection that is usually resistant in most commonly used antibiotics used to treat ordinary staph infection. Causes of MRSA is when a person has a cut or sore and comes in contact with another person or object that is infected with the MRSA virus. MRSA, often called superbug, can commence as a minor skin sore, pimple, or boil before becoming serious, potentially harmful, and sometimes fatal. Not only did I experience MRSA myself about 6 years ago, I also remained hospitalized for this life-threatening infection for 1 month at Forest General Hospital. Symptoms of MRSA can quickly turn into deep, painful abscesses that require surgical drainage. Sometimes the bacteria remains confined to the skin, but it can also burrow deep into the body, causing infections to bone, joint, surgical wounds, the bloodstream, heart valves, and lungs. Risk factors can be in different settings. In hospital, you can be affected by a weakened immune system by having an invasive medical device such as an IV line or urethral catheter. Carriers of MRSA have ability to spread it even if they are not sick. Risk factors in the community can be spread through contact sports, through cuts and abrasions, outbreaks, and occur in military training camps, child care centers, and jails. And homosexuality are at their higher risk at getting MRSA. About 2% of people in the U.S. are carriers of MRSA, which is carried on the skin and most commonly in the nose. Doctors diagnose MRSA by checking tissue samples of nasal secretions for signs of drug-resistant bacteria. It takes 48 hours for the bacteria to grow. Treatment for this superbug is according to the susceptibility of strains. Sometimes antibiotics can be administered. Doctors may choose to drain a superficial abscess rather than treat it with drugs. Prevention is important to prevent spread of infection. Hand washing remains the best defense against germs. Keep wounds covered, keeping cuts and abrasions clean. Avoid sharing personal items such as towels, sheets, razors, and athletic equipment, or any object that can be used and spread with germs. Shower after games and practices. Again, don't share towels. Another way of prevention is to sanitize items, wash towels, and bed linens in hottest water H2O settings, adding bleach if possible. In conclusion, my speech today was to educate y'all on MRSA, the spread of infection, and to give you key ways to prevent spread of this bacteria. My experience of fighting for my life after contracting MRSA in my hip joint and pelvis led me to realize just how serious this infection is and makes me want to inform others of the preventions of this deadly infection.